So I will start with, since I think we have started there at that level. So let's look at pathophysiology of hypertension. Um, it's necessary that we understand exactly what hypertension and how hypertension operates and how it affects the human body. And the first thing is to understand what the word pathophysiology is. Pathophysiology is actually trying to study the action of the disease to the smooth functioning of the body. For an example, if we are looking at the pathophysiology of let's say malaria, we will be looking at we are going to be trying to look at how malaria affects the functioning of the body and which organ principally does malaria affect. That's what pathophysiology is. So we are going to be looking at the pathophysiology. We are going to be looking at how hypertension affects the smooth functioning of the body and which are the organs we are going to be looking at. We see organs like the kidney, the liver, the heart, and blood vessel. Principally is blood vessels. Take note, blood vessels, that is the artery. We go from the word hypertension, that's blood pressure, right? Increased blood pressure, persistent increase in the blood pressure of a patient. And when we talk about blood pressure, we mean the force exerted by blood on the walls of an artery. Take note, the force exerted on the walls of an artery. So in hypertension, the force is excessively high. That force is excessively high. So in order to understand exactly what the pathophysiology of hypertension is, just as I've mentioned, we need to understand key things. We need to understand what cardiac output is. We need to also understand what peripheral resistance is. Before we go there, you need to understand what cardiac output is. Take note, I'm taking it step by step so that you may understand and write properly. Yeah, except that you are writing. If you are not writing, it means that your head is a computer, which is good. So, cardiac output is heart rate, is the amount of blood sent out by the ventricles in a single heartbeat, and is calculated by heart rate times stroke volume. That's how cardiac output is calculated, and it's very simple. Then if we are talking about blood pressure and we are saying there is a force exerted by blood on the wall of an artery, it means cardiac output is part of blood pressure. So in calculating blood pressure, we'll be looking at cardiac output times peripheral resistance. Take note of that. Peripheral resistance is the force in a blood flow, right? The force exerted also. The resistance blood exert on the walls of an artery. So take note of that. So blood pressure is actually cardiac output multiplied by peripheral resistance. Take note of that formula because we will come back to it as I'll be explaining and going. Everything I'm saying, it may sound very light, but it's very, very, take it gradually. And you know, the peripheral resistance matters with respect to the volume or the size of the artery. Peripheral resistance is low in an artery with a big lumen, with a lumen that is big. Then the resistance become high in when the lumen is low because of what? Sympathetic nervous action in the walls of the artery. Normally when the artery is at rest or when the artery is not having like hypertension, it's very normal. The walls of the blood vessel is thick, and as it is thick, the peripheral resistance is low. You and I know that when the volume of water flowing, when the volume is let's say when the volume is high, there is always low pressure, and when the volume is low, there is high pressure. That is what peripheral resistance stands for, and that's what it represents. And also, that is what we will be looking at. So take note, these key things I've said: cardiac output and peripheral resistance. That is what we are going to be focusing our mind on. So when the blood vessel narrows because of some sympathetic nervous actions on the walls of the artery, the peripheral resistance becomes high. And when that peripheral resistance becomes high, it results to decrease in blood flow. So when the volume of the blood vessel has reduced in size, there is limited amount of blood supplied to various organs of the body. And when the amount of blood vessel leaving the heart to various parts of the body is reduced or is limited, there are various reactions we get in the body. You start getting organ failures. But principally, once you look at what does reduction in the flow of blood does to the kidneys, because it's the kidney, the liver, and the heart and the blood vessels that we are going to focus in our mind on, because these are the key organs that hypertension affects. So we are saying when there is increased peripheral resistance, there is reduction in blood flow to the entire body. And when there's reduction of blood flow to the entire body, what does it do to the kidneys? Now, when there is reduction of blood to the kidneys, a chemical, there is a two pathway. There's a chemical that is secreted by the liver. We call that chemical renin. Take note of that. Take note of that chemical. We call it renin. Renin is a chemical that is produced by the liver to the kidney because of reduction of blood flow to the kidneys. And when this chemical is produced, it has two pathways. Take note, it has two pathways. Key things to note about it. When this renin carries out its function to the kidneys, it forces the kidney, or to an extent we can say it ignites the kidney to produce a chemical called angiotensinogen. Angiotensinogen is an inactive protein. Also, is necessarily not produced by the liver, by the kidneys alone. It's also part of it is produced by the liver. Take note of that. So this renin converts this inactive enzyme. It leads to the conversion of this active enzyme angiotensinogen to angiotensin, angiotensin 1. Take note. So renin leads to the conversion of angiotensinogen, which is an inactive protein, to angiotensin 1. And an enzyme also converts angiotensin 1 to angiotensin 2. That enzyme is called angiotensin converting enzyme. Take note, that enzyme is called angiotensin converting enzyme. And take note, the significance of angiotensin 2 is that angiotensin 2 is a potent vasoconstrictor. It is a chemical that is produced which helps to increase peripheral resistance by reducing the lumen of blood vessel. So it causes constriction of blood vessel. That is what angiotensin 2 does. So it's a vasopressin, it's a vasoconstrictor. That's what it does. That's the first pathway of renin. Renin leads to the conversion of angiotensinogen to angiotensin 1. And angiotensin 1 is converted to angiotensin 2. And this angiotensin 2, it is a vasoconstrictor. So it leads to the reduction of lumen of the blood vessel or the volume of the blood vessel, hence increase in peripheral resistance. When increase in peripheral resistance occur, blood pressure, as I was saying, I said blood pressure, to calculate blood pressure is cardiac output times peripheral resistance. And when we are talking about peripheral resistance, we are talking about the force that that blood actually, or the resistance to blood flow in an artery. And saying we said when the force is high, because when the lumen of the blood vessel has decreased, maybe because of fat accumulation, ions, it reduces, hence the peripheral resistance increases. And when it increases, there's going to be reduced blood flow to organs like the kidney. And when organs like the kidney are reduced, they have a reduced circulation of blood, you will notice that it will produce a chemical called renin. And this renin helps to convert an enzyme called and to convert a chemical called angiotensin converting angiotensinogen, which is produced by the liver. We say it's an inactive protein. And so this angiotensin is converted to angiotensin 1, which is an active protein. Then, by the help of an enzyme called angiotensin converting enzyme, it converts angiotensin 1 to angiotensin 2, which this angiotensin 2 is a vasoconstrictor. This vasoconstrictor is it increases peripheral resistance by reducing the lumen of blood vessels. And the second pathway that renin actually does is that renin will lead to the production of aldosterone in the kidneys or in the adrenal gland. So we are saying renin leads to the production of aldosterone, and you and I know that aldosterone leads to it causes the reabsorption of salt, that's sodium and water. Normally, when there is water, where there is salt, you can easily get water because water is attracted towards salt. And because water is retained in the body, because salt and water is retained, since the kidney is principally its function is to help in the production of urine and also filtration of waste, removal of waste, and to regulate the amount of water or the osmotic balance or the water balance of the body. So it leads to when the volume of water increases, when blood volume, when it leads to the reabsorption of water in the body. The reabsorption of water, when there's too much water in the body, blood volume normally increases. And when blood volume normally increases, the heart cannot store much blood. And because the blood volume has increased, cardiac output must probably increase. Just as we said, cardiac output is heart rate times stroke volume. And this is affected by blood volume. Are you getting? So we are saying at this point in time, when the volume of blood in the body increases, cardiac output is bound to increase because water has increased and the ventricles are bound to pump more blood to the entire circulation so that it should not accumulate, water blood should not accumulate in the heart. And in so doing, cardiac output increases. And you and I, we go back again. You'll notice that it goes back. We have seen that angiotensin 2 it leads to is a vasoconstrictor. And we are also noticing that aldosterone leads to the reabsorption of water and salt in the body, which leads to an increase in blood volume. And when blood volume increases, it leads to increased cardiac output. So we are seeing increased cardiac output caused by aldosterone, and we are seeing reduction in blood in the lumen of blood vessel caused by angiotensin 2. That is, peripheral resistance will increase. So cardiac output and peripheral resistance will increase because of the action of angiotensin 2 and an increase in the blood volume caused by aldosterone. So the cycle like that continues. And now, when this blood volume and peripheral resistance continues, it can also, it continues, the cycle continues like that. It can lead to when the blood vessel, when the high blood pressure increases, it will lead to the destruction of blood vessels, and there will be reduction of blood flow to the kidneys. And when there is reduction of blood flow to the kidneys and other organs, renin will be produced, and renin will lead to a conversion of angiotensin to angiotensin 1 and angiotensin 1 by the help of an enzyme produced by the lungs. It will lead to the conversion of angiotensin 1 to angiotensin 2, which is a vasoconstrictor, which will reduce the lumen of blood vessel, hence increasing peripheral resistance. And aldosterone that is produced, that is ignited by renin because of to reduce a volume of blood supplied to the kidneys, it will lead to reabsorption of water in the body system. And when blood increases in the body system, it leads to an increase in blood volume. And when there's an increase in blood volume, there is normally going to be increased cardiac output. And so that cycle and that continues. So how then, where does medications that we use for blood pressure comes in? Some of the medication that we use for blood pressure is, we call it angiotensin converting enzyme inhibitor. What does this medication do? It comes to prevent the conversion of angiotensin 1 to angiotensin 2 because angiotensin 2 is a vasoconstrictor. I hope you guys will get the point. So it prevents the action of angiotensin 1 to the conversion of angiotensin 1 to angiotensin 2. Hence, there will be no vasoconstriction. And also, there's another medication again that we are going to use again. That medication helps to prevent it prevents the action of aldosterone from reabsorbing water and salt, so that the water and salt should instead be excreted, so that the volume of blood should not be much that will lead to increase in cardiac output.